Osborne. I'm the developer and the author of the book Pre and Perinatal Massage Therapy. And I want to speak with you a little bit about the advantages of side-lying positioning over prone positioning. This is a question I get asked often by therapists, and its importance led me to be a part of the team that developed the side-lying positioning system with OakWorks. So let me first of all just review a little bit of the structures of the pelvis as relevant to pregnancy, and then some of the reasoning might make a little more sense. First of all, I want to point out that prone positioning on a flat therapy table is going to do several different things. It's going to create some stress and additional lumbar lordosis, so it's going to mean, particularly when we press on a client to work therapeutically in the lumbar spine, it's going to mean some additional strain to the lumbosacral junction and to the lumbar structures. If we have a flat table that the client is lying on, that's going to mean also that the baby is going to be pressed into the table, and that can create some increase in intrauterine pressure, which has the potential to be problematic for the integrity of the pregnancy. So for these very important reasons, a flat table is not a good idea. So you might be thinking, well, let's cut the table out, or let's use some cushioning systems that will allow some space for the belly. The uterus is supported in the pelvis by some ligament structures that are illustrated in this illustration here. And these ligament structures are connected to fascial attachments in the pelvis. I'm going to show you now on the pelvis itself, and this again will help this to make more sense for you here. So the ligament structures, the round ligament crosses from the front of the uterus and it comes across the pubic bone here. The broad ligaments that attach from the side of the uterus and into the ilia, and the sacrouterine ligament that's here in the attachment from the uterus to the anterior of the sacrum. So it's pretty easy for you to see, if you think about that, that if we were to put this pelvis in a prone position, in a cutout table, or in some sort of a support that has a cutout area to it, one of the very structures that hurts in pregnancy is the sacrouterine ligament, and this position will take the entire weight of the baby and hang that down, suspending it, dangling it basically from that sacrouterine ligament. And so while the prone position could be comfortable for a woman for resting, it could be perfectly safe for her to sleep or to rest in that position. There are a number of really important reasons why it's both more comfortable and more therapeutic and safer for the woman to be supported on her side rather than in the prone position for these very basic anatomical reasons. So I hope that with that understanding, you will see the importance of having a system like the OakWorks side-lying system, or the use of pillows or other kinds of cushions, so that a woman is positioned on her side in a supported, well-supported, side-lying position as this headrest, torso cushion, and the leg bolster, a wedge for under her belly if needed, and an additional pillow that can go either for under her arm or under her leg for height. Thank you, and if you'd like more information about prenatal massage and positioning, please be sure to connect with me through my website or my books.